If you're thinking of potty training your kid in 2025, I have a couple pieces of advice for you. I'm a pediatric early intervention occupational therapist and pelvic floor therapist, and I work with kids all the time that are going through the woes of potty training. So I just wanted to share some things that I have found to be successful and some things that don't work quite as well. But also remember that every child is completely different in things that work for them, as well as every family. So if these things don't work for you or didn't work for you in the past, that's okay. First thing, definitely do a potty learning phase before ever jumping into potty training. You want your child to feel comfortable and confident with this new routine and their body and the sensory experience and the sounds and smells and sights of the bathroom and toilet. Definitely get like a little floor potty, get a potty that goes over the main seat, and just talk about it a lot. Read some books, do all the things. Second piece of advice, don't start potty training until your child is ready for this skill. If they are not showing any signs of potty readiness, it might not be a good time to dive in. We don't want to just throw children into something that they're not prepared for. This could lead to anxiety and stool withholding and refusals and all of that jazz down the road. A method that a lot of families use and have had success with that I personally don't love is the naked method. Use that to your own accord, but I just don't love it. I think it's really confusing for kids, but to each their own. Also, know that the 3-day method can be helpful or successful, but like truly potty trained in 3 days is nearly impossible without any kind of prep work or I call them leaks, not accidents, happening in the future. I avoid the word accidents because I feel like it just has a negative connotation with it. So I like to use the word leak or spill in place of it. And last, just know that nighttime dryness often comes way after daytime training. Sometimes kids get it both at the same time, but no, if your child is dry during the day and still waking up with a full diaper in the morning, that's totally normal and it's okay. Don't take away their diaper or pull up in hopes that they'll just learn it. Overnight training is not something you can train for. They'll get there when they're developmentally ready.